Hi, I'm Joseph Berardo. At MagnaCare, we believe that all citizens need to be informed about the health care issues that affect their lives. That's why we're proud to support the programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by New Jersey Council of County Colleges, MagnaCare, activists, in cooperation with the American Medicine Chest Challenge, New Jersey Natural Gas, proud to support education in our communities, Wells Fargo, the New Jersey Education Association, and by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. Promotional support provided by Commerce Magazine and by The Record, North Jersey's trusted source, and northjersey.com.
Hi, I'm Steve Adubato. Teen driving, everyone talks about it, but who's actually doing something to protect our teens? It is my honor and my pleasure to introduce two very special guests. Ronni Clerico-Knittel, Student Assistance Coordinator at Manalapan High School, and Viviana Martinez, Manalapan High School senior and a participant in a program called Save a Brave. What is Save a Brave?
Well, Save a Brave is an organization for seniors in Manalapan. It really helps spread awareness about the importance of safe driving and the risks of distracted driving, impaired driving, and just really helps send a good message throughout the school about, teen driving in general.
Let's talk about this a little bit. The whole idea for this program comes through our partners and friends at New Jersey Manufacturers. I'm curious about this. There's also a connection with a program that is called You Got Brains. Is that what it is?
Yes.
You Got Brains is done in connection with the Brain Injury Association?
Alliance of New Jersey.
What is that, and how is that connected to Manalapan High School?
They contacted us a few years ago and
The Brain Injury Alliance?
Yes, the Brain Injury Alliance, and told us about this program that they have, that they encourage teen groups to enter and showcase what they're doing in the fight against drunk and distracted driving and just poor driving habits.
Right.
Our school joined in about 3 years ago, and every year we enter their contest. Last year we were fortunate enough to win.
With this video?
With all of our activities through the year and our music video, which really clinched it.
And so the whole idea here is to deal with the fact that teen drivers, I mean, sometimes, listen, we all make mistakes sometimes out on the roads, not all of us, but a lot of us. But teen drivers, let's be candid about it, sometimes there are too many teens in a car. Sometimes they are distracted because they're texting or they're doing God knows what else, right?
Yes, definitely.
On the phone. Sometimes there's drinking involved. So there's a video that you were not involved in, but you were inspired by, right?
Yes.
That we're about to see connected to the Save a Brave program, right?
Yes.
This is the video that won?
Yes.
This one. Let's take a look at the video, music video that inspired you and had an impact on a lot of other kids.
Don't text or drink squat. Don't want that mugshot. Trust us, you'll get caught.
Hey, yeah, hey.
Okay, now you were close towards your destination, but you were drinking. You put yourself in danger. Words from your mouth were slurred. Your vision was blurred. An accident occurred.
And that's why you were such a bad boy. 'Cause you were speeding. Now someone's bleeding. Then you'll be pleading with your parents. So much frustration, a bad situation. Now you don't wanna take the school bus.
You know, as we look at that video, it's so interesting, obviously playing off a very popular song. What's the difference between having adults come in, give a lecture about teen driving, and having teens produce that video for teens? What's the difference?
When you were a teenager, would you rather have heard a message from the cool people in your school?
Clearly.
Or
the younger,
an adult?
clearly a peer. So is that the idea of peer-to-peer?
Yes. Peer-to-peer has been proven the most effective way to get the message across to teenagers.
And when you saw this, what grade were you in at the time?
Well, I was a junior last year when they produced the video, But it was great because like the kids that made them, they were my friends. You know, they were only a year older, and it was just great seeing them be a part of something that was just so good. It had such a good message, and it was fun too at the same time, and it was just really inspiring.
Inspired you to do what though?
To just try to join Save a Brave, because Save a Brave requires an application to get in. So I definitely knew I wanted to apply, and you know, it just sent the message throughout the whole school. You know, the video went viral, like on Twitter, like it went on YouTube, Instagram. Everyone was talking about it, and it was just a great thing that they did.
And we should also make it clear that Save a Brave, the term brave, is that the Manalapan?
Yes, that's our mascot. We're the Manalapan Braves.
Okay. What has been the reaction from the other kids to this program?
It is the club to be in.
It is.
It's very prestigious. You have to apply, like Viviana said. I take all of the applications. This year I had 75 applications for 20 spots. And you know, I look at how involved is this child in school? What are their grades like? What is their attendance like? And behavior. You know, I really want the best of the best in this group. And we narrowed it down to 20, and they are the best kids. They're fun, they're involved, they're enthusiastic and sincere. They really do believe in this cause. They believe in safe driving, and just they lead by example, not
Sure.
only because of their music videos and the programs they do.
But also, Viviana, you have actually been in some of these situations that we saw in the car, right? Describe that.
Yeah, definitely. Well, we're high school kids, obviously, so you know, we go to football games, we go out to eat, we have a lot of friends in the car. Most of the time, we're not allowed to have more than one person in the car because of the graduated driver's license law.
It's the law.
Yes, it's the law. So if you're under 17 years old and you have your license, you can't have more than one person in the car. But you know, unfortunately, not a lot of people follow that. So it's dangerous when there's a car full of kids and they're loud and they're having fun. There's music on. It's just one of the most common situations that I find myself in.
What do you do in that situation?
Well, it's hard in that situation because usually you're with your friends and it's uncomfortable to say like
Peer pressure.
Yeah, definitely.
What do you say?
You know, the most important thing to say is just to make sure that you're comfortable with what's going on, and obviously, you know, you're not going to be if the driver's distracted. So usually what I say is, you know, guys, just like be careful. I'm going to call my mom. She's going to come pick me up. Like, it's fine. Like, I'll meet you there. You know, that's usually the better thing to say. No.
You will not get in the car.
No.
That sends a powerful message in the time we have left. What message does that send to everyone watching, every teen, every parent, particularly young people? What message does it send?
It empowers other teens to know that this is your life and it's your responsibility to be safe for yourself and for your friends.
Final question. What would you want to say to every teen watching, not only on public broadcasting and Fios, but also when they see it digitally? Because apparently I've heard that teens like watching, sometimes not on television, but on some device.
Definitely.
What's the message to them?
I would say, you know, you're not invincible. You're a 17-year-old kid. Don't be overconfident. There's so much that we have to learn, especially with driving and even apart from driving anything else. But the most important thing is just to be careful and, you know, not have that sense of being invincible, because when something bad happens and you realize that you're not and something bad can happen to you, the consequences could be terrible.
You are a role model. Keep doing what you're doing, Viviana. And Ronni, thank you for leading this effort. We appreciate it. Good work. Stay with us. We're right back right after this. That's great stuff.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
We're pleased to welcome Mario Schlosser, who is the co-founder and co-CEO of Oscar Insurance Company. Mario, I want to make sure I got your last name right. How do you say it?
Mario Schlosser.
All right. You see, a New Jersey accent is close. But by the way, for those who don't know what Oscar Insurance is, what is it?
Yeah, it's a good old-fashioned insurance company with a good mix of technology in it. We started the company about 3 years ago. I'm one of the co-founders. All three of us originally come from the world of technology, and so we were building, in our previous lives, if you will, technology products that people get excited about, that were useful to people. And all three of us kind of felt that this excitement is really absent in our interactions with healthcare. I had 2 kids in the past 2 years, a 1-year-old, a 2-year-old. The 1-year-old just came fresh from an ear infection last weekend. And so you start really interacting with the healthcare system a lot more than you used to. And in all these interactions, we felt that it's difficult to find a doctor who you can really trust. It is hard to understand what something will cost you before you go into a doctor or into a hospital. And in many ways, what we felt was the insurance companies seemed to make the job even more difficult to get done, and the world more complex in already complex healthcare system. And so we said, can we start an insurance company that would do 3 things very well? One is simplify health insurance and simplify
So you're
healthcare.
going to simplify health insurance.
Yes.
Give us one example of how you are, quote unquote, simplifying health insurance.
If you come, for example, to our mobile app or the website, you hit one button and a doctor will call you right back. Takes
No
about
way.
10 minutes. It's totally free,
No way.
unlimited, no, 24/7. Yeah.
You
That's
hit,
what we-
okay, you get the app.
Uh-huh.
You press a button.
Uh-huh.
You press, and what happens?
And there's a doctor waiting on the phone, essentially call you back. He gets all of your health
Or
history.
she.
Or she, of course, exactly. He or she gets all of your health history. So he or she would see your prescriptions, your previous medications, your previous diagnoses.
all there?
All there. He or she can call you back, diagnose you over the phone, prescribe you over the phone, and then we know, of course, using our technology, which pharmacy you live closest to, and the medication he or she prescribes goes directly to the pharmacy. You can go and pick it up, and you're good to go. And that whole interaction was totally free that I just described. So
Free?
Yeah, exactly.
Then explain the economics.
Well,
The premium's gotta be higher.
The nice thing, it's very comparable to where other plans in New Jersey are selling in the same markets.
By the way, let's make it clear. There are currently 5 plans under the Affordable Care Act. You may have heard of it. It's otherwise known as Obamacare. As we do this program, there are 5 companies that are competing for business in the insurance exchange, and Oscar is one of them.
That's right.
So go ahead.
Exactly. So we're very comparable in terms of what the premium is for comparable networks, comparable ways to go and see a doctor. As an example, a bronze plan would cost you around $290 per month for a 30-year-old. A silver plan would cost you about $317 a month for a 30-year-old. So very comparable to where the rest of the market is. But the nice thing about health care and health insurance really is that if you look at it with a fresh pair of eyes, and this is, I think, really what Oscar is, a company full of experienced health insurance and healthcare people, but also full of experienced technology people who typically wouldn't work in healthcare and health insurance. And the mix makes the magic, really. So if you look at healthcare with these new, fresh set of eyes, you see so many things that just should be done differently. And if we can keep people out of the emergency room, if we can keep people out of the urgent care center, for example, by just giving them a phone call with a real doctor from New Jersey, we can save you money, we can get you healthier more quickly, and that's how the economics then will end up working even for us.
The name Oscar, where's it come from?
Great-grandfather, one of the co-founders.
Is that right?
When he came to the US, yeah, that was the name he adopted when he came to Ellis Island. And so we thought it was a just great personalization of the company. You know, we wanted health insurance to be much more personal. When you call us, we pick up the phone directly. There's no long waiting time. There's no outsourcing of call centers going on. We do it all directly from within the office. When you have a particularly complicated question about a claim or a policy or whatever, literally the person from the customer service desk stands up and walks over to where the technology people and the health insurance leaders of the company sits and can discuss the question. So it's very much in the family, if you will. You know, we like to look at the members even we have as an extended part of the family as well. That's how we act.
It's interesting to me. How engaged are you? I mean, you don't have your background is largely in technology.
Yep.
How engaged and interested are you in healthcare delivery?
Very interested. We kind of think that as Oscar, we can be almost your entry points to the healthcare system. So we can really help you find a great doctor. We can help you communicate with a doctor. We have a team of nurses and doctors even in-house who can help you orchestrate your care, if you will. So we routinely talk to all of our diabetes patients, we talk to our cancer patients, we talk to all the pregnant women and the new mothers in the membership base to kind of stay in touch with them, hear what's going on. We have a real-time feeds of when you get checked into an emergency room, and we can call you right away when we see you in the ER, so we can advise you on your benefits and things like that. Yeah.
Ironically, as we do this taping, I just happened to have been in an emergency room yesterday for something which I won't disclose on the air. Well, don't worry, I don't think I'm going anywhere anytime soon. But here's the thing. You're saying if I were insured by your company, so you would know that I was in that emergency room?
If you want us to know. Of
if
course,
I want you to know?
Exactly. When we onboard you as a member, we explain to you in a much more intuitive way than I think other insurance companies would, how your plan works, how the network operates and things like that. And one of the things we ask you is, can we get some more information? Do you authorize to get some more information about when you access care? And then one of the feeds we would get is this real-time notifications when you go
so
to
I want you to know, I'm there. Do you reach out and say, hey, Steve, what's up?
We reach out, yeah. We call you up with one of our doctors or one of our nurses, and all we do is simply say, do you need any help? And so what we then find is about 81% of the people pick up the phone right away and talk to us about what just happened. And we, in some cases, can even do things like the ER scheduled them with an out-of-network surgeon. They would have had to pay lots of money if the surgery had gone through. We can right away then make sure to say, he is a great doctor, maybe an even better doctor who can take you on as well, do the surgery. And
it's that hands-on?
Yeah, it's that hands-on. And I think it needs to be. I think one of the things, again, the original frustration that I felt, as a father of 2 kids and, trying to go and get healthcare in the best possible way, just is, tell me how this works, the system. Co-pays, co-insurance, deductibles,
break it down for me.
All that stuff, just exactly guide me through it. And so we said, Oscar, simplify. Those are the 3 things. We want to simplify the system. We want to guide you through the system and get you more convenient access to care, one of which is the button that then makes the doctor call you back and treat you.
Well, as we all try to navigate the healthcare system, Mario, we appreciate you coming in and talking about Oscar, and particularly as the Affordable Care Act moves forward through this second enrollment period and beyond. And we wish you and your colleagues nothing but the best. Keep us posted.
Thank you so much.
Thanks so much. Stay right there. We'll be right back right after this. That was really interesting.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
KyungHee Choi is Vice President of the Korean Medical Program at Holy Name Medical Center. Good to see you.
Good to see you. Thank you for the invitation.
You were just telling me before we got on the air that in your program, the Korean American program, medical program, how many people, how many patients come? Is it 40,000?
Yes.
At the Holy Name Korean Medical Program. I don't understand how it can be possible to be so many. Are they all in the Bergen County area?
They are coming from all over. Mostly about 60–70% of them are coming from Bergen County. But this program attracts Korean American people from all over. So they don't mind traveling far away to get that culturally sensitive medical service.
Let's talk about that. You talk about culturally sensitive services. Now, as getting ready for the program, I started realizing that you're talking about dietary options. First of all, what are we talking about when it comes to dietary options?
First of all, we are dealing with first-generation immigrants. Korean Americans are a new wave of immigrants into this country. So that means many of them are not comfortable with English, and their culture is very much ingrained into Korean way of doing things.
Okay.
And food, different ways of doing things. So Korean food actually is very important factors when you are ill.
Give us an example.
For example, you want to eat soup instead of very sandwiches and toast. You rather eat rice. And we want to serve, when you deliver babies at Holy Name, we want to serve seaweed soup. That is 500-year-old tradition in Korea.
It is.
Because in olden times, think about it, you didn't have a whole lot of good food available to recover after delivering babies. And seaweed soup was one of the best.
Is that right?
Yes. When I delivered my babies in this country, my mom came. She insisted that I eat seaweed soup for 3 months. And surely I did. And it's very good source
Part
of
of the
nutrition.
tradition as well.
Part of tradition, good base of nutrition.
And the other thing is that, excuse me, that when it comes to the water by the bedside, warm water?
Yes, because we believe, a lot of Korean Americans believe that it's not a good idea to drink icy cold water. You want
I always drink icy cold water. Now you have me rethinking
when you are
this.
ill, you don't want to shock your body too much. So by drinking cold water, you're shocking your body. And therefore, our tradition is to drink warm water or warm tea. So in the U.S. hospital system, you bring icy cold water. Even after delivering babies, I was shocked.
And so being culturally sensitive means being aware of that, being aware
Right.
of, how about this one? Red ink.
Right.
What is it?
In
Why is that
olden
even relevant?
times in Korea, in family registrar office, they were handwriting, right, in everybody's name in black ink normally. But when person dies, that person's name is moved to red ink. So that's the way you differentiate between the people who are alive versus dead.
So you don't write in red
You
ink.
don't want to write that way.
And the patient's room, the number 4,
Right.
is significant because?
Number 4, when you write in Chinese character, it means death.
So being culturally insensitive, right? You don't have a program like this. You don't have the Korean medical program. You have no program like this. Someone comes in, first generation, come into your hospital. You assign them to room 24. The number 4 is in the room.
Right.
You don't even think twice.
Right.
That has an impact
It has.
on that patient and his or her family.
Sure, especially when you come in, you are ill to begin with. You are not feeling well. You are nervous. You don't understand the system. And then you see number 4. Then in your own mind, you say, oh my God, this is bad luck.
It adds to it.
It adds to it.
You want less anxiety.
Exactly. That's why we have a Korean medical program, to deliver the culturally sensitive medical service.
You know, as I talked to your president and CEO, Mike
Right.
Marin, who's big advocate of your program, the other thing I picked up is the Korean physicians.
Right.
He talks about that a lot. Talk about that.
We have 85 Korean American doctors who are affiliated with Holy Name Medical Center. And they are not only good Korean American doctors, but they are really competent, highly skilled physicians. So this is a great asset to Holy Name, not only Holy Name, but also to Korean community members. So 85 doctors, you don't find anywhere with this many competent, well-trained physicians in one location. And they are the ones who are providing that culturally sensitive medical service.
Language matter?
Language, it matters, and some people may, although they don't speak fluent Korean, since our program, it's 7th year at Holy Name, a Korean medical program, their Korean skills have gotten so much better.
Really?
So yes, because a lot of patients are coming through their office, and they try very hard to learn if they don't speak the language. Even though you may not be able to speak Korean language at all, being a Korean American doctor means a lot to Korean community members. So that kind of a closeness, that kind of feeling is a big factor.
Let me ask you this. Are there any particular illnesses, diseases that disproportionately affect those who are Korean?
Yes, there's quite a bit of disparities in the area of hepatitis B.
Hepatitis B.
Right. And Asians in general, not only Koreans, but Chinese too, 1 out of 10 hepatitis B carriers. And Caucasians, the numbers are very small. So we are talking about Asians having 30, 40 times higher in terms of prevalence rate. And then another area is diabetes.
Diabetes? Why?
Diabetes, I think it's a lot to do with the food intake. It's a double whammy. A lot of Korean people, when they leave Korea, come here, and they are still eating lots of rice and noodles, a lot of like carb, right? And then they go to McDonald's and Wendy's and eat hamburgers. So the combination is not very good. When you do the blood test, 100 people for diabetes,
right.
Half of them, 50 of them are either diabetic or pre-diabetic. So diabetes is a really serious issue. This population, Korean Americans, is even worse than people who are living in Korea.
Worse.
Worse, because people in Korea, Korea has gotten so much more rigorous in educating people about good diet and exercise, and health is very important government policy there. But here, a lot of people are having tough time and adjusting to different culture, living their own life course, met, and educating kids. So they are just way too busy with that.
So ultimately, in the few seconds left, in the end, it really does matter that medical health care is culturally sensitive. You just can't say everyone, one size fits all. You don't buy that.
No. No, and certainly by customizing, delivering the specific sensitive medical service, when people are sick, they are feeling so much better.
Yes.
And again, they are willing to travel from far away.
Well, thank you so much. You have one of the largest programs in the country, and we appreciate you sharing us this important information.
Thank you
so
for the
much.
invitation.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. N13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by New Jersey Council of County Colleges, MagnaCare, Activists, in cooperation with the American Medicine Chest Challenge, New Jersey Natural Gas, Wells Fargo, the New Jersey Education Association, and by New Jersey Sharing Network. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision. Because you can make a difference and save a life.